Do you ever wish that you could go back in time and give advice to your younger self? And as I thought about my steps into dermoscopy, I realised how much I've learned in 10 years. I started to write down key points I would tell my younger self at the beginning of my journey, and I thought, it's too late for me. But not for you. Maybe one of these 20 points will be the key to unlocking and speeding up your primary care dermoscopy greatness, taking you to that next level of your journey. Learning dermoscopy is much like learning a musical instrument. It doesn't happen by chance. It involves you setting aside a little time each day to practice. It will feel unnatural to start, but give it time, your skills will improve and the results will speak for themselves and spur you on, guaranteed. No, I'm not going to blow my own trumpet, but use your dermoscopy daily. Here's a few ideas that have helped me and that may help you. When wanting to learn a new skill, it's natural to think, is there a course I could go on? Stop! Do you really need to? They cost money, which could perhaps be put to better use. It's easy to come away from a course with lots of notes and good intentions, but information overload and a headache. Try little snacks instead. We grow best with a little bit and often. My video course and manual have been written with this in mind, to trickle good dermoscopic nutrients into your body and whet your appetite for more and slowly build your skills. And it's for free. I'm now going to contradict myself a little, which is nothing new. But training courses do have value, although I would recommend 6 months of experience with a dermoscope on your own patients first. And in that way, you'll develop dermoscopic teeth and a stomach, so by the time you go on a course, you'll better understand and digest the contents they feed you. You will know when you're ready for such a step and get so much more from the experience as a result. Go on a course, but not in the first 6 months of using a dermoscope. The first car I ever bought was called a LADA. They were cars made in Russia when the Italian car manufacturer called Fiat upgraded and sold all their old 1960s technology car making equipment to Russia. Question: how do you double the value of a LADA? You fill it with petrol. What do you call the rear heated window of a LADA? A hand warmer. What do you call a LADA convertible? A skip. We got used to it and I loved it for that reason. It was my first car. But when we upgraded to a Volkswagen Polo, we realised driving could be, well, a pleasure. If you buy a cheap dermoscope, compromises will have been made in build quality, battery life, and perhaps more importantly, the lens quality. You will enjoy dermoscopy more, learn quicker, be less frustrated and less likely to give up if you invest in a quality instrument from the start. Cheap is cheap for a reason. Buy the best hybrid dermoscope you can afford, saving up if necessary. It can be a lonely experience in primary care, isolated from colleagues in our decision making, but many things in life are much more fun when done with others. Whether that's playing football or going for a walk in the countryside, seek out and develop a network of like-minded people. Sharing dermoscopic pictures and decision making with them is not only more fun, but it will provide you with support, encouragement and put your learning curve into overdrive. Build a local support network. Another nugget of wisdom I'd like to pass on to my younger self is to realise that I will never be as skilled in dermoscopy as my consultant colleagues. The simple reason is that I don't get enough practice on the difficult stuff. The populations we serve are different to theirs. Consultants are masters of the pathological. We are masters of the benign and normal. We often find the pathological just by recognising that we don't recognise it, if that makes sense. Our role is mostly triage, reassuring our patients that what they have isn't cancer, and so preventing an unnecessary referral, patient worry and any medically induced harm. Become a master of the benign. It's what we do best in primary care. What gets you excited in life? What are you passionate about? I'm loving watching my grandchildren take their first steps, learning to speak and interact with this amazing world we're all born into. I tell my younger self that it's not always the big things that give true value and meaning to life, but the small things. A smile, a hug, a thank you. Don't expect to diagnose many melanomas, but do watch your patients' faces and body language as you tell them there's nothing to worry about and what they have isn't cancer. That's a thrill you should never get tired of. Get used to telling people they haven't got cancer. Enjoy. Here in the UK, there's another side to that. Other than your patients, don't expect anyone to care about the time, money and effort you are putting into learning a new skill that benefits your patients. You will even meet resistance from some. Learning dermoscopy has many rewards, but money is one of them. Do it for love, not for money. Sometimes learning a new skill leads you to opportunities you never imagined when you first started out with faltering steps. I learned to play the trumpet first at the age of 10 because my dad loved jazz and he always wanted to play the trumpet. I hated practicing, but I ended up joining a concert band, and spent many a weekend as a teenager performing in a concert, working my way up from third trumpet to second trumpet to lead trumpeter. We were then invited to Vienna, Australia to be in a competition with bands from around the world. I played my favourite solo piece backed by a band of 30 musicians in front of a large audience. What a memory! And it all started with that daily practice, when such a future possibility was but a dream. Dermoscopy can open new possibilities that you could only perhaps dream about at present. For me, it helped me expand my skills in minor surgery, such as removing cancers, which is fun. And for you, it can enable you to become a GP with an extended role, working alongside consultants in their clinics. Dermoscopy opens up new opportunities. I'm supporting a couple of colleagues in different practices to use dermoscopy. One of them said to me only last week, "Andy, my colleagues are starting to come to me as the go-to person for skin lesions, but I'm only just a beginner." I laughed because I remember that feeling all too well. Others will notice your new interest and growing skills and turn to you for help. That is flattering and scary, all rolled up into one. I would say to my younger self, take it as a compliment. It also makes you more valuable as an employee. See it as an opportunity and a reason to push on and keep developing your new skill. Embrace it. Writing scripts for these videos often involves storytelling. I don't know if you've noticed that stories, films and books have a well-recognised story arc. There's the introduction of characters, the setting and a conflict of some sort that's arisen. There's a tension and challenges that emerge that needs to be overcome by our hero before an intense climax and a turning point towards a conflict resolution and an ending, usually happy. There's a story arc in learning dermoscopy. You are the hero and you're wanting to learn a new skill needed to fight and rescue your patients from that nasty dragon, skin cancer, that could eat them alive. But for you to succeed in that quest, you have to overcome various challenges on the way. Finding someone to train you in the art, raising the money for a good sword, a dermoscope, and through daily practice refining your skills until they become second nature to you. Then, just as you think you're making great progress in your quest, you make a mistake. You misdiagnose a skin lesion. You feel awful. How will you respond to such a setback and a blow? Will you give up? Or learn and overcome because your quest is that important? I have missed an early melanoma covered in one of my videos, and talking to my skilled dermoscopic colleagues, they've all missed something. It will happen to you. Don't let your story end there when it happens, because it will. I find patients very gracious when we try our best but errors happen. What is not tolerated is not trying our best. You will make mistakes. Learn from them. How can you learn from making an error in dermoscopy? The best way I know is to take good photographs. It took me too long to realise this and how important it is to take them and put them into the notes very quickly. I can now do this in about 60 to 90 seconds. Pictures paint 1,000 words and enable your errors to be spotted and for you to learn from them. Become a good photographer and learn to put them in the notes very quickly. As a family, we love canal holidays, sailing on a network of canals built during Britain's Industrial Revolution and used as the highways of the day to transport items such as coal quickly and efficiently. There's nothing quite like pottering along at less than 4 miles an hour, steering a 60-foot barge from village to village, exploring the English countryside. However, any adventure on water has its risks of drowning, so taking sensible safety precautions such as wearing a life jacket at all times when on top of a boat is vital. While mistakes will happen, we can do things to reduce the risk. For us in primary care dermoscopy, our life jacket is, if in doubt, refer it out. Sometimes it's as important to realise what something can't do for us as understanding what it can do. For instance, a fitness tracker can't make you lose weight on its own, but it can help you track your progress and stay accountable. It's just a tool to help you reach your goal. In the same way, dermoscopy is just a tool we use to diagnose a patient's skin lesion without resorting to a knife. Don't forget the other vital components that are key to that goal. Taking a good history to understand the patient's personal risk factors and past medical history, and understanding how those impact your differential diagnosis list, the history of the skin lesion and its location on the body, and your patient's ideas, concerns and expectations. Dermoscopy is but one part of making a diagnosis and management plan. When you're starting out in dermoscopy, it's good to have quick wins to give you early successes and help you grow in confidence. If I went back 10 years, I'd tell myself to focus on mastering these 5 skin lesions first. They are very common, so you'll get lots of practice and prevent many unnecessary referrals very quickly. Master these 5 most common benign skin lesions first. Not all dermoscopic signs are equal in value, I've discovered. Some, like shiny white structures, make me sit up and take notice, which is why I call them start worrying structures. I would tell myself the following dermoscopic skills will give me greater decision-making abilities the sooner they are mastered. Pigmented aggregated globules versus comino-like openings. Comedo-like openings are a sign of seborrheic keratosis and are very reassuring. But because they are dark and there's a few of them clustered together, they can easily be confused with pigmented aggregated globules, which is one of the signs of a melanocytic lesion. And if it's a melanocytic lesion, is it a melanoma? If you learn to tell the two apart, you are going to do well in using dermoscopy as a diagnostic instrument. The second dermoscopic signs I'd group together to try and master earlier on are pigmented network pattern versus the fissures and ridges pattern of a seborrheic keratosis. That's because a pigmented network is one of the criteria used to identify a melanocytic skin lesion. And if it's a melanocytic lesion, it could be a melanoma. While fissures and ridges occur in seborrheic keratosis. If you can crack the ability to tell one from the other, your confidence and abilities to manage patients will blossom. One of the harder skills to master is deciding if an atypical nevus is really a melanoma. If there's any suspicion or new changes of growth, they just need referring and cutting out quickly. However, I've learned to check the patient's other moles first, because often it's just their signature type of mole and they tend to produce ugly looking moles. Maybe their personal risk of melanomas is increased, but if it's not growing or changing, it can actually be safely monitored. For nevi, check out other nevi first and work out the patient's signature type. I'm so happy I started dermoscopy 10 years ago despite my faltering steps. It's a bit like taking a long hike up a mountain. You have to have a plan, otherwise you're going to wander aimlessly. But as you reach each new vantage point to take in the view, it just gets better and better the further you go. You will be grateful you took that decision. Dermoscopy is a voyage of adventure and not a final destination. Wasn't that the name of a film?